Hi friends. So most of you have appreciated the Train Your Brain series with respect to the questions that we had framed for you in the subject of pathology and obviously the related questions in medicine. This is the time when we are going to be talking about the Train Your Brain series with respect to the subject of microbiology, which a lot of you shared is not a very strong subject for most of you. But then I'm going to be sharing certain hacks with you or certain clinical presentations along with important images which are very much likely to be asked in your exam. Let's get started with the discussion. The first one talks about a clinical presentation of a patient who is going to be having the presence of a pseudomembranous gray-white tough membrane on the pharynx. And the keywords or the buzzwords in the exams can be the patients are going to be having the presence of something like maybe a bull neck. The patient can be having the presence of bleeding on scraping, and the patient could be having complications like myocarditis or neuropathy. Of course, this is what is going to be an easy one for you because you understand that this is going to be a picture of a patient suffering from Corynebacterium diphtheria infection. The moment I'm going to be talking about the term like the pseudomembrane. This is a very important image that you need to remember with respect to Corynebacterium diphtheria, wherein the patients are going to be having the presence of the bacteria, which are having the presence of this kind of a special appearance, which most of you understand is going to be having the presence of the special staining, which is given the name of Albert staining. So this is very important from the perspective of the exam. That is what you just need to remember over here. The next one makes a mention of a patient having the classical features of the presentations like the presence of lockjaw or trismus. Then you can be having a presence of a smile, which is given the name of rhizus sardonicus. The patients can be having a posture which is abnormal, which is given the name of opisthostonus, especially after a wound which has been contaminated with the soil. Usually the patients are not going to be having the presence of any kind of a sensory loss, and of course this is going to be another example of a Clostridium infection, but this time around we are going to be talking about Clostridium tetani. That's what is going to be asked in the exam. The next one makes a mention of a patient who's going to be having a presence of honey crusted lesions around the nose and mouth in a child. And when you're talking about the presence of the golden crust, they are going to be having the presence of superficial vesicles that are going to rupture. Now, this is something which is going to be very typically seen in patients who are going to be having the presentation of something like impetigo. And whenever I'm going to be talking about impetigo, this is something which can be caused because of two important types of the gram-positive cocci. Either it can be because of Staphylococcus aureus or it can be because of Streptococcus pyogenes. The next one makes a mention of a patient having the presence of an abrupt sore throat. The patient is having the presence of fever and tonsillar exudates. There can be a presence of a tender anterior cervical lymph node enlargement, and the patients are going to be having the presence of a sandpaper rash. There is a presence of a keyword over here which is going to be given the name of strawberry tongue. The moment I'm thinking in terms of something like a strawberry tongue, I'm thinking in terms of a sandpaper rash. Of course, you know the answer. This is likely to be a patient suffering from Streptococcus pyogenes pharyngitis, and the presence of something like the presence of this kind of a rash would be reminding you that the patient could be suffering from what is going to be given the name of scarlet fever. Next one makes a mention of a patient having the presence of descending flaccid paralysis. There is a presence of diplopia. There is a presence of dysphagia. So all these coming to your mind, especially after an intake of either of the two things. Specifically in case of an infant, that could be because of the fact the infant has been given honey, or there could be a situation where the patient has consumed home canned food. The canned food is going to be having the presence of growth of a bacteria. The bacteria is going to be releasing the toxin, and the toxin is what most of you identify. That's going to be Clostridium botulinum toxin. That is what you need to remember over here. Now, the moment I'm talking about Clostridium botulinum toxin, may I remind you the fact, how does it work? It is going to be inhibiting the presynaptic release of acetylcholine, an example of a toxin which can be given for the patients who are going to be having any kind of a spasmodic condition affecting the muscles. And may I remind you the fact that when I'm going to be talking about Clostridium botulinum, it's also being used as a paper to dermatology fact, which is going to be taking care of something called as crow feet, or the patients who are going to be having the reduced chances of some kind of a wrinkling. The next one makes a mention of a patient having a history of severe watery diarrhea. There is a presence of rice watery stools after particularly contamination of water in an endemic area, and because of the presence of watery diarrhea, the patient is experiencing rapid dehydration. So this is the buzzword, the rice water stools, and of course this is something which is going to be associated with the organism that's given the name of Vibrio cholerae. As a important fact with regards to a PSM question, any place where you have a contamination caused by Vibrio cholerae and the water in the ground is not suitable for drinking, such hand pumps are being marked with a red paint. So that is what they love to ask as a PSM question, of course an old one at that, and that is what is to be kept in mind. Of course, when we are talking about something called as a ORS solution, this was earlier made for treatment of patients suffering from cholera. But nowadays we understand that the new WHO ORS solution is directed for taking care of viral diarrhea, especially the commonest cause of diarrhea these days in children happens to be, of course, you know the answer, that's going to be rotavirus. The next one talks about a patient who's going to be having the presence of a high fever. There is a presence of relative bradycardia. Now, this relative bradycardia, friends, do you remember the fact that is what is read in medicine is given the name of Faggot sign. Normally, and that's a paper 1 question of physiology as well, with every 1 degree Celsius increase in the temperature, the heart rate should increase by 10. But in patients who are going to be having this condition, the fever is present, but the heart rate remains just like that. So the heart rate remains normal, and that is what is called as relative bradycardia. The keyword would be the patient is having the presence of an abdominal pain. Patient is going to be having the presence of rose spots. The patients can be having the presentation of alteration of bowel habit, which can be the presence of constipation, and then he could be having the presence of diarrhea. And specifically, there is a history of contamination of consumption of water, which may be because of 3 reasons. One can be because of a travel to endemic area. Second can be because of a contaminated water supply, which you found quite recently in one of the states as well. And the third could be people who are in the habit of eating भैया वो extra पानी देना please पानी पूनी के बाद. That is what is going to be causing the trouble over here. This is what we are talking about over here. This is going to be Salmonella typhi. I expect most of you to talk about this kind of a picture. I want you to remember this particular image from the paper 1 of your exam. This is what is going to be given the name of the Wilson-Blair medium, wherein the bacteria is going to be showing you the growth, and that is how it is going to be picked up for the purpose of making a diagnosis. Never ever to forget with regards to the treatment of this condition, they'll have to ask you about the importance of third generation cephalosporins as well as the role played by fluoroquinolones. That is what is extremely important to be kept in mind. Having said that, we are talking about a patient, very classical history of immunosuppression. It can be a patient who's going to be having some kind of a burn injury, or a patient suffering from cystic fibrosis, and the patient is going to be having the presence of formation of a greenish blue color pus. Usually this is going to be associated with presence of a fruity smell in the patient, and the question may make a mention of the fact that it is an NLF, that means a non-lactose fermenting gram-negative rod, which is going to be causing the trouble over here. With the history, that is something which is very easy for you to decode, that we are dealing with a patient who's suffering from a condition called as Pseudomonas aeruginosa. Very classical paper 2 question or a pharmacology question we'll have to ask on exam is Pseudomonas is an example of, most of you remember, it's a Ziddi bacteria. So what's a drug that is going to be given for its treatment? Of course, ceftazidime. And you're going to be adding with it an example of an aminoglycoside. Maybe a drug like amikacin in combination with ceftazidime would be doing the shots for you so far as the treatment of this kind of an infection is concerned. Pretty dangerous infection that we see in the hospitals, and therefore a very important cause of development of nosocomial infections. What's a nosocomial infection, guys? Patients having an infection 48 hours after being admitted to the hospital, right? See the next one, the patient is having the presence of a painful genital ulcer. And the patient is going to be having the presence of an ulcer, which is going to be having the presence of a ragged appearance. That means presence of undermined edges and soft base. There is a presence of tender inguinal lymphadenopathy, and that is because of an example of a sexually transmitted disease. The moment we are thinking in terms of a painful genital ulcer, of course, the patient is going to be crying because the oxab dukh raha hai, and when he says dukh raha hai, that's the time when you remember about the Haemophilus ducrei. So the patient is crying because it is extremely painful. The other thing that we are talking about over here is going to be an example of a sexually transmitted disease, which is classically going to be a painless indurated genital chancre. And you know, if that is a word, that can be a direct hint for you to talk about treponema, or it can be a presence of a painless ulcer. And then it talks about the presence of a generalized rash, which can involve the palms and soles, and patients can be having the presence of a generalized lymphadenopathy as well. Of course, you know about the fact what we are talking about over here is treponema pallidum, which is an example of a organism which is going to be responsible for causing chancre. No doubt about the fact that you know that in the primary stage it is going to be responsible for causing chancre. In the secondary stage it is likely to be responsible for causing a rash, and in the tertiary stage it is going to be causing involvement of the central nervous system as well as the cardiovascular system. Thereby the patients are going to be having the development of neurosyphilis, or the patients are going to be having the development of cardiovascular syphilis. Now, the importance of knowing about the cardiovascular system involvement in syphilis is that these patients are at high risk of involvement of the thoracic aorta, and because of that, the patients can be having a development of an aneurysm in the aorta. This is what is to be remembered over here. Talking about the next one, a patient, he is a college student and he is having a sudden high fever. He is also having the presence of a headache, and there is a presence of neck stiffness. On top of it, the patient is also having the presence of a petechial rash, and there is a problem in the patient in the sense that patient has a downhill course. He goes in for a state of a rapid shock. On the CS examination, what you observe over here is that he is having the presence of a gram-negative diplococci. So this particular history is very much suggestive of the fact the patient is going into a state of meningitis, And whenever we are talking about a meningitis, presence of a gram-negative diplococci is what is going to be talking about the fact that my patient is suffering from Neisseria meningitidis. Please remember the relationship between Neisseria meningitidis and complement protein deficiency, particularly if my patient is having a late complement protein deficiency. What do I mean by that? That was INICET question. C5, 6, 7, 8 deficiency would enhance the risk of development of Neisseria meningitidis infection. The other thing that they ask in the exam is, whenever I'm going to be talking about this particular bacteria, it is given the name of meningococcus, and it is going to be fermenting which sugar, glucose or maltose, and the answer is, of course, what you know, both of them. Whenever I'm going to be talking about the other important example of a bacteria, which is going to be a gram-negative diplococci, which is going to be having its present inside the neutrophils and is going to be responsible for causing urethritis with a purulent discharge, and it is going to be responsible for causing dysuria. What I would be thinking in case of a sexually active individual is going to be a condition, and that is going to be the infection caused by Neisseria gonorrhoeae. So most of us do remember the fact that in case of Neisseria gonorrhoeae, which is also called as gonococcus, it is only and only responsible for causing fermentation of the glucose, not maltose. So that is how it is going to be. And that's an example of a classical presence of the bacteria inside the neutrophils, which is the image that they give you in your exam. Do not miss this image. Extremely, extremely important. See the next one. The clinical presentation of the patient is again going to be something like this, and it has made already mentioned the fact. So just for the sake of repetition, what we are dealing with over here is a patient suffering from the Treponema pallidum infection. See the next one, which talks about a patient who's going to be having history of being not immunized, unvaccinated child. And what we're going to be observing in this case of unvaccinated child is he's going to be having the presence of whooping or paroxysmal cough. Now, whenever we're going to be talking about whoop, in contrast to something like wheeze, which is an example of an expiratory sound, whoop is typically inspiratory. So much of the cough is there, the patient can actually have a development of an episode of vomiting as well. So that's given the name of a post-tussive vomiting. And the patients are going to be having the presence of a lymphocytosis. The moment I'm thinking in terms of this, of course, the first thing that comes to your mind is the patient is going to be suffering from the infection caused by the bacteria that is given the name of Bordetella pertussis, right? Whenever we are going to be talking about the presentation of atypical pneumonia in a young adult, what's atypical pneumonia? Also called as walking pneumonia. The patient actually walks down in your clinic. He's having the presence of a dry cough. He's having the presence of a low-grade fever. There is a presence of diffuse interstitial infiltrate. That's a classical pathology question that they put up to in the exam, both in paper 1 as well as in paper 2. And the question is making a mention of this very, very important hint, presence of cold agglutinins. So the moment I'm thinking in terms of cold agglutinins, I'm thinking in terms of infection caused by the commonest organism causing atypical pneumonia, which happens to be, as most of you understand, Mycoplasma pneumoniae. What exactly is going to be a situation where Mycoplasma pneumoniae can be causing infections when people are present in a crowded area? Say for example the hostels, say for example the military barracks, say for example the wonderful places where you are staying in. Small places, large number of people, overcrowding is there, and therefore the transmission of the bacteria becomes very, very easy. The next one that I talk about is going to be an example of a patient having a presence of a chronic non-healing ulcer, especially after a cat scratch. So that is going to be what is called as the meow phenomena, and the patients are having lymph node enlargement. You can actually see the presence of the bacteria on the special stain. The bacteria, the special stain by which you see the bacteria is given the name of the Warthin starry stain. And of course, you know the name of the bacteria over here. When I'm talking about the cat scratch disease, you're going to be thinking in terms of something called as Bartonella henselae. Now, one thing is that you talk about Bartonella henselae, which is responsible for causing the cat scratch disease. What is the other important thing that they ask in the exam? This is what is going to be associated with what is going to be given the name of the stellate granuloma, the star-shaped granuloma. What's other Bartonella that they ask in the exam, guys? This is Bartonella quintana, the organism which is responsible for development of trench fever. I hope you know that. Of course you do. The next one makes a mention of a patient having epigastric pain which becomes worse at night and has been relieved by meals. Typically, the patient is going to be having the history either which is going to be going with chronic gastritis, or the patient is going to be suffering from an ulcer in the presence of the involvement of the duodenum. And the question can give you a very, very important hint. In fact, that's a separate question asked in the exam. The patients could be having the presence of a positive urease breath test. Alternatively, what he can be making a mention of the fact over here is the patient is having the presence of a test which comes out to be positive in him, which is given the name of CLO test. What is CLO, guys? Of course, you know the answer. That was a previous exam question. Campylobacter-like organism. What we are referring to over here is a bacteria that is the number one bacteria responsible for causing the chronic gastritis as well as duodenal ulcer, which is going to be given the name of H. pylori, Helicobacter pylori. The moment I think in terms of this particular organism, of course, I know about the commonest location in the stomach, that happens to be the antrum. I know why this bacteria survives inside the acidity of the stomach because of being urease positive. And of course, the important and the very, very important in classical pharmacology question, what do I do for the treatment of these patients? ट्रिपल ड्रग थेरेपी, बिल्कुल ही नहीं भूलना है आपने, बहुत ही कॉमन चीज़ है और आपके प्रैक्टिस में भी काम आएगी. See the next one. The patient is going to be having the presence of what is given the name of a traveler's watery diarrhea. I mean, यही एग्जाम में आपका important hint आता है. And the question can give you the hint after eating street food. No matter howsoever the tasty or the famous the street food is, it always had this enhanced risk or development of causing the traveler's watery diarrhea. Patients can have crampy abdominal pain. There would be no blood as such. And the only good point is that this could be an example of a self-limited condition. So typically that is going to be caused because of an organism that is going to be given the name of enterotoxigenic Escherichia coli. Of course, you know the fact that when I'm talking about Escherichia coli, the one which is having the presence of that alphabet T over here is what is going to be associated with the traveler's diarrhea. That is what they ask you in the exam. The other important example of Escherichia coli, which is very commonly tested on your exams, guys, is going to be the one that you associate with this presentation, where patient is going to be having the presence of high risk of hemolytic uremic syndrome. So let me just talk about the presentation. The patient is going to be having the presence of a history of consumption of either raw leafy green vegetables, or there is a consumption of non-vegetarian food that include undercooked meat or beef, and the patient is going to be having the presence of a bloody diarrhea and abdominal cramping. He could be having the presence of high risk or development of what is mentioned over here, hemolytic uremic syndrome. Now, what is hemolytic uremic syndrome? Of course, you know the fact these are patients who are going to be having the presence of microangiopathic hemolytic anemia. Patients are going to be having thrombocytopenia, and the patient are as high risk for development of acute kidney injury. The triad is what is known to you. What's the organism which comes to your mind? Of course, you know the fact it is going to be caused because of Shiga-like toxin. But what they love to ask on the exam is the species of the Escherichia coli. This is O157H7. Just to remind you of the fact that we are sometimes asked an important INICET kind of an image-based question, which talks about the presence of the anthropathogenic Escherichia coli. And I hope you remember the fact that there is going to be a presence of an attachment effacement lesion that is going to be formed because of the pylori over here. That is what they love to ask in the main. But for your exams, the Shiga-like toxin and the presence of the traveler's diarrhea is what they typically give you in your exams. The next one that we talk about is a clinical presentation of a patient having the presence of abdominal diarrhea, bloody diarrhea, especially after eating undercooked poultry. Now, specifically that is what is going to be made a mention of in the exam. The patient was having a consumption of something like eggs. So eggs is what is going to be causing the trouble over here. Now, another important hint, and that's a classical paper 2 fact, guys. The patients are going to be having a development of a reactive arthritis, and these are the patients who are going to be at high risk for development of the Guillain-Barré syndrome. So which organism comes to your mind if I'm talking about a high risk for development of Guillain-Barré syndrome after having an episode of abdominal cramps and a diarrhea, and that too after consumption of contaminated eggs? Of course, I'm thinking in terms of an organism that is given the name of Campylobacter jejuni enteritis. Extremely important. Don't forget, I'm saying it for the third time. Campylobacter jejuni enteritis associated with high risk for development of GBS. That's what is to be kept in mind. See the next one which talks about, and that's an easy one. Of course, you know about this pseudomembranous colitis. That's a buzzword that they tell you, or they talk about a history of a patient who was given some kind of a broad spectrum antibiotic. Why was he given that? Because of the presence of some previous pre-existing infection. After being administered this, the patient was having a history of development of a watery diarrhea, and in the stool examination, he was having the presence of a toxin. So pseudomembranous colitis, also called as antibiotic associated colitis, is what is going to be caused because of the organism. Of course, you know the answer. This is Clostridium difficile. May I remind you of the fact that when I'm talking about Clostridium difficile, which is the most important antibiotic which is going to be causing this, it is typically going to be seen because of exposure or the intake of third generation cephalosporins. Please also be familiar with the fact what are the antibiotics which can be given for treatment of Clostridium difficile enteritis. So the patients are going to be treated with the help of drugs like 3 drugs that they ask in the exam. Of course, you know the names, guys. Fidaxomicin. The second one that you need to remember is metronidazole, and the third one that you talk about is vancomycin. क्या इंपॉर्टेंट चीज पूछते हैं वैंकोमाइसिन के बारे में पेपर 2 में आपके एग्जाम में? इट इज वन ऑफ द फ्यू इंडिकेशन, द ओनली इंडिकेशन आस्क्ड इन अ स्क्रीनिंग एग्जाम वेयर इन vancomycin is going to be given to the patient by the oral route. So that is what you need to remember. The next one is what confuses a lot of people in the exam, and I hope it doesn't confuse you. history of a lady, she is expecting, that means a pregnant lady who is having a history of consumption of soft cheese or pre-cooked meat, right? Then she is having an experience of something like a fever, malaise and a flu-like illness. But when the baby is being born, the baby is having the presence of meningitis and sepsis. So the mother had a history of consumption of something like a soft cheese and pre-cooked meat, and the baby has been born because of the presence of a meningitis and sepsis. We are thinking in terms of an organism that is given the name of Listeria monocytogenes. Very, very likely to be missed in the exam. Either you know it or you don't. आता है या नहीं आता है, but exam के अंदर क्योंकि अब आपको समझ में आ गया because आपने train your brain series देखा है, so आप इस question को ठीक कर देंगे, right? See the next one, which talks about a hunter, which is who is having the presence of a painful skin ulcer with regional lymphadenopathy. Now, when there is a regional lymphadenopathy and there is an ulcer, it can combine. The word which can be written over here is ulceroglandular lesion. And typically, this is going to be seen after handling of animals like rabbits. And that can be because of the fact that rabbits are going to be having a contamination by the ticks. So what we are talking about over here is an example of one of the bacteria that you associate with the Ella sisters. Remember the Ella sisters? So the organism that you need to talk about over here happens to be Francisella. So Francisella tularensis, this is also being given the second important name of tularemia. Tularemia, right? So tularemia is what is going to be having a history of the individual getting that infection because of the contamination caused by the animal, and this is going to be asked in the exam again, just like Listeria, an example of a question which not too many people get correct in the exam. I hope आप लोग इसको ठीक कर देंगे, confidence रखेगा, revise करते रहिएगा. When we are talking about the presence of then a painless cervical lymphadenopathy, especially in a child, and then there is a presence of a word like Gons focus being mentioned, it makes a mention of enlargement of the hilar lymph nodes, it makes a mention of a primary complex which is going to be present in the interlobar fissure, lower part of upper lobe or upper part of lower lobe, and classically the patients are going to be having the presence of the infection caused by acid-fast bacilli. Of course, none of you will forget this ever. A public health problem asked in PAC, asked in microbiology, asked in PSM, asked in pharmacology. Of course, how can you miss that such an important organism? We are talking about something called as Mycobacterium tuberculosis. An example of the staining which I love to ask in the exam, the ZN staining, the Zeal-Nielsen staining. Of course, since I made a mention on the fact the patient was having the presence of Gons focus, this is specifically a question pertaining to what is given the name of primary tuberculosis. What will they give you as a history in a patient likely to be suffering from secondary tuberculosis? Mark my words, this is going to be associated with presence of chronic cough. The patient is going to be having the presence of hemoptysis. He's going to be having the presence of night sweats, weight loss, and the question will talk about this, guys. Cavitary lesion on the chest X-ray. You do not find, I repeat that, आपको ध्यान रखना है, you do not find a cavitary lesion in the X-ray in case of primary pulmonary tuberculosis. The presence of a cavitary lesion in the lungs is a feature suggestive of secondary pulmonary tuberculosis. What kind of necrosis would you have it in a patient having tuberculosis? Of course, caseous necrosis, and therefore the combination of the term caseating granuloma. So if I'm talking about the presence of a cavitary lesion in the lungs, this is what is going to be suggestive of Mycobacterium tuberculosis. This is an often asked question in the exam. How does somebody get primary TB? It is because of droplet infection. But if the question talks about how does somebody get secondary tuberculosis, it is classically because of reactivation of the pulmonary tuberculosis. So the bacteria are going to be latent and then they get reactivated whenever there is going to be a local immunosuppression. That is what you need to be familiar with over here, right? See the next one that talks about the fact the patient is going to be having the presence of a hypopigmentic anesthetic skin patches. The patients can be having the presence of the glove and stocking peripheral neuropathy, and the patients could be having in the late stages the presence of the leonine phases. Of course, something which is not very commonly being seen in the OPDs because we have almost kind of taken care of this particular condition. But if I'm talking about mycobacteria, this should remind you of the organism that is going to be Mycobacterium leprae. Be familiar with the drugs which are going to be given for the treatment of Mycobacterium leprae infection, including the role of dapsone, including the role of clofazimine, including the role of rifampicin. That's what they have to ask you in the exam time and again. See the next one which talks about the patient who's going to be having the presence of erythema migrans, which is going to be associated with the bullseye rash. Typically, patient has malaise, patient is going to be having the presence of a fever after a tick bite. And what kind of a tick bite? Ixodes. So Ixodes tick bite associated with this, and the hint in the exam, subsequently the patient is having a development of a facial nerve palsy as well as arthritis. So there is a tick bite caused by this particular tick that we're talking about over here, and there is a development of facial nerve palsy. Of course, what we are thinking in terms of over here is a condition, you know the answer, Lyme's disease. What's the causative organism for Lyme's disease, guys? You know the answer. It's a kind of a tongue twister, but most of you are pretty good at it. And that is going to be given the name of Borrelia burgdorferi. So Borrelia burgdorferi is going to be associated with Lyme disease, associated with the history that we just talked about, arthritis, facial nerve palsy, particularly after the rash, which is a bullseye rash, and there is a development of something like the infection caused because of the tick bite. See the next one, which talks about patient having the presence of fever. The patient is having the presence of severe myalgia. There is a presence of headache. There is a macropapular and then petechial rash, which is starting on the wrist and ankles and is going to be spreading centrally. Now, please do not forget that all this is taking place. I mean, you may think in terms of something like even dengue over here, but what it talks about over here is a patient who's going to be having an exposure to ticks. So you are going to be talking about the presence of a rash, which is initially macropapular, then petechial, then going over here, and that is what is suggestive of the infection caused by the rickettsia, and that is going to be, the diagnosis happens to be the RMSF, which means the Rocky Mountain Spotted Fever. For any kind of rickettsial infection, may I remind you, what's the antibiotic of choice? That's an easy pharmacology question. Tetracyclines is what you never are supposed to forget. See the next one, which talks about the presence of a patient who happens to be a vet guy, or he happens to be in close contact because he happens to be a farmer, and therefore he is in contact with animals like sheep and goats, right? And therefore he is going to be having the presence of a rash, he is going to be having the presence of an atypical pneumonia, along with the presence of, rash is not there, there is an atypical pneumonia, there is a presence of fever and headache, but no rash is going to be seen in these patients, and that is what is going to be suggestive of. We are yet to find the causative vector over here, but what we are aware of is a condition that is given the name of Coxiella burnetii. You remember Coxiella burnetii? What kind of granuloma do we have it over here? हमने पढ़ा था path के अंदर. You remember the मेदू वड़ा story that I share with you always? Donut granuloma is what I'm talking about over here, and this is what is going to be responsible for causing Q fever. That is very, very important. Then making a mention of a patient having a history of being exposed to something like unpasteurized consumption of milk, or maybe because of exposure to the animals. There is a presence of a classical word mentioned in the exams, undulating fever. He could be having the presence of night sweats. Night sweats is not an exclusive feature of tuberculosis. A lot of people make that mistake. ये गलती नहीं करनी है आपने. Night sweats can be seen over here in this condition as well. In fact, something which is going to be causing joint pain, causing night sweats, and is going to cause hepatosplenomegaly. But the keyword over here happens to be the exposure to something like livestock or dairy, and there is an undulating fever. We are talking about an organism that is going to be associated with brucella. So undulant fever, that's why it is being called as, is associated with brucella. That is what is to be kept in mind. Now, making a mention of something which is going to be seen because of exposure to rats or rodents, or because of the presence of fleas which are going to be seen. Something which caused a lot of trouble. If you are a Gujarati, you understand that Surat trouble, which happened many, many years back. Patients were having the presence of high-grade fever. They were having the presence of painful swollen lymph nodes, and that is what is going to be given the name of buboes. Right? I hope most of you can see them over here. And the problem with this condition is that the patient can have a complication. This can progress to something like pneumonia or sepsis. So of course, what I'm talking about over here is an example of a condition. If you got the hint, of course, I'm talking about an example of a condition that is going to be given the name of plague. And if I'm talking about plague, what is going to be causing plague? You remember the organism Yersinia. So Yersinia pestis is what I'm talking about, and that is what is going to be responsible for causing plague. Next one talks about a patient who's going to be having the presence of a severe atypical pneumonia. Severe atypical pneumonia, patient is having the presence of high-grade fever. This patient is having the presence of GI symptoms including diarrhea. And an important word, never ever forget this word guys, hyponatremia. So exposure to the organism takes place because the patient is going to be having the air conditioning duct exposure. It can be seen in case of the ICUs as well, or the patient is going to be staying in a hotel and the patient is going to be having fever, he's going to be having diarrhea, he's going to be having hyponatremia. What would immediately strike your mind is going to be that we are dealing with a patient who's going to be suffering from a condition called air because of air, pneumophila, air-loving organism. The organism that should remember by you is going to be Legionella. So Legionella pneumophila is what we are talking about over here. Again, important thing is, even though it's a bacteria, still it is responsible for causing the presence of an atypical pneumonia in the patients. Do remember the fact that sometimes Legionella pneumophila can also be responsible for causing only and only fever, and that too a mild kind of fever guys, and that is what is going to be associated with the word Pontiac fever. They love to ask you this as a question, classically as a paper 1 question of exam. People remember about Legionella, people remember about this history, but just a twist of the words. अगर वो आपको एग्जाम में Pontiac fever पूछ लेते हैं ना, आप मेरे को विश्वास रखना 10 से 20% लोग एग्जाम में फंबल कर जाएंगे, कंफ्यूज कर जाएंगे, unless and until उन्होंने ये चीज रिवाइज कर रखी है. Pontiac fever is what you associate with something like Legionella pneumophila. That is what is to be kept in mind. Then making a mention of a patient who's going to be having a history of immunosuppression. Now that can be because of the multiple reasons. Patient can be a patient of HIV, or this could be a patient who is on high dose, immunosuppressive therapy or steroid therapy for quite some time. He is having the presence of a chronic granulomatous infection, and he shows the presence of a partially acid fast filamentous organisms, Especially the patients could be having the presence of a cervicofacial or pulmonary lesions. So this is what is going to be giving you a very important hint that patient is going to be having the presence of a partial acid fast filamentous branching rods. He is having the presence of a history of immunosuppression, and this is what is going to be associated with what kind of a condition. So typical organisms which they'll have to ask on the exam which are acid fast in nature beyond tuberculosis, you have to think in terms of something like nocardia over here, nocardia over here. Now that's an example of a very classical image, and I hope you can just revise and quickly have a look at this kind of an image wherein you can look out for the presence of this kind of a branching rod-like structure that you associate with an organism like nocardia, right? So beyond nocardia, because beyond mycobacteria, you can be talking about something like the cryptospora, isospora, also examples of acid-fast organisms. This is what they'll have to ask you in the exam. So this was about the brief discussion so far as important bacteria and their important clinical histories or the relevant histories were concerned. In the next session of the microbiology Train Your Brain series, we are going to be talking about the next subset of the microorganisms. Stay tuned and do take very good care of your health. Thank you so much for appreciating this series. That gives a lot of vital energy required to make that effort of making another video. Take care for your exams. As always, best wishes.